So, Mike, we've talked many times, but just orient our group to what you do and your collaboration with Shine and the Isolite.
First, I'd like to tell my life story. Is that
Okay,
okay?
perfect. Yeah, yes. Yeah. It's like a dentist. Yes, please stay. In fourth grade, my teacher's name was Mrs. Smith. She wasn't nice. So, yes, thanks.
Yeah. So for those of you guys who don't know who we are, what we used to be called Isolite Systems. We changed our name to Zyrus a couple years ago. We're the makers of the Isolite system, the ISO Dry, and the ISO Vac. And as Paul, as you said, it provides suction retraction, it provides aerosol reduction up to 90% during dental procedures. And what we've done is we've partnered with Henry Schein to make sure that all dentists around the country and North America in general, right, can have access to our system, right? And so we're really proud to be partnering with them.
And Mike, I want to share, because I don't know if this helped with me getting married, but possibly it did. So my awesome wife, Mrs. Nacho, she loves that name. She's a teacher. So when you're a teacher, you have 1 week to get your work done, the week between Christmas and New Year's. That's the only time teachers can do anything in their life. So when we were dating, she came in to get her teeth cleaned. And I don't like doing this as a dentist. Now, some dentists love this, but I do not like when someone's getting their teeth cleaned and they need a filling or this, and you do it the same day. It's not my thing. I'm a systems guy. Some dentists love it. They cram them in. We'll do your filling now. But she needed 2 fillings done, and she was a teacher. So I said, we're going to have to do it now, right? So I was annoyed on the inside. I pretended not to be annoyed on the outside. We're dating. Now we're married. I'm annoyed on the outside all the time. But I brought her in, and I probably was working quickish, getting everything done, not telling her much, saying, hey, we're going to do these now. Not how I would really talk to a normal patient. But I put the Isolite in, did it, right, quickly. And I took it out, and she goes, man, that thing is great. I've always been afraid the dentist was going to cut my tongue. And that was a great way because I didn't even prep her for that. So it's something that enhances the patient experience. So if somebody wants to reach out and learn how to get it through Shine, we have a special text code, text Shine to 55444 to learn more about my best friend, the Isolite. Now, Mike, one of the things, I don't know if you saw my CBCT sponsor, dentists ask a lot of questions. They ask a lot of questions they can perceive as negative. So watch this. Mike, I want to use the Isolite, but it's too expensive for me, right? Even though it's going to make my life better. What is the cost to start putting this in your practice roughly?
Yeah, roughly it's around about $1,900 for the Isolite per chair.
Gotcha.
Plus mouthpieces, right? And I think that it's all relative, right? But I think the value that it provides far outweighs that initial expense, right?
Well, that's a Nacho brainer. You've spent $2,000. Then mouthpieces range what to use the one time? What's their range of cost?
$2.75.
Right. So we have $3, which makes you work faster. Now we are in this pandemic. It's been quite annoying. Share with us. We are all into right now, suction, less aerosols. What people believe and what people feel about this can be 2 different things, but we're at a point where creating less aerosols is a popular thing. Isolite helps with that. So what have you seen in your dental offices? Have they been ordering more? Have new customers come in? Are they using it in hygiene?
All of the above, right? So we've seen a tremendous amount of new customers coming in from the demand to reduce aerosols. And by the way, we've been talking about aerosol reduction as part of the value that their Isolite provides for like 12, 14 years, right?
Just took a few months for people to notice.
Nobody cared until about 6 months ago about that part of it.
Yeah.
But it does help with the aerosol reduction. And we're hearing from, dentists, assistants, and hygienists alike that it has been a huge help for them. They don't see the spatter or the splatter on their masks anymore, right? So it's not like we're just making this up, right? It's a real thing. And so not only have we seen a lot of new customers coming in, we've seen existing customers add more systems to outfit all of their operatories, including hygiene, because they don't have enough money to hire assistants for their hygienists to run an HVE with them, right, when they're doing their SRPs. And so having that Isolite, IsoDry, IsoVac on the chair with them, no matter where they are, has been a huge help for them. And then also, I think we're seeing a lot of traction through Shine, and they're seeing a lot of demands there as well.
I mean, describing me as a dentist and how I work with my assistant, I would describe myself as a big giant man baby who needs help with every single thing that I do. So I need the assistant with me at all times. However, during this crazy time with staffing and teamwork, we sometimes need our assistant to go out of the room. So when you have the Isolite, patient can stay open, do it. And just yesterday, so while I was sharing with confidence. I had a patient agree to a great treatment plan, profitable overdenture. Another one of my patients had one of their implant abutments, I don't know if there's a technical term, stuck inside the implant. So I put in the isolite so that when I was trying to get it unstuck, if it popped out, I at least knew the isolite was going to act as a dam. So it's so versatile in decreasing annoyance. That should be your motto. We are very versatile in decreasing dentisting annoyance, right?
Decrease annoyance.
Yeah. So I appreciate you coming on here and sharing. I'm so glad that Shine has partnered with you. People can reach out to their Shine reps. I was just talking to them on a show. So I think that's great. Anything else you'd like to share with our Nacho community about the isolite, Shine, or anything before you jump off, Mike?
Yeah, I just think it's worth trying, right? Think of it like insurance, right? You hope you never need it for when that time you drop that crown or you drop the screw, but when it's there, it's amazing, right? And a lot of customers have been buying the isolite right now around with the aerosol reduction in mind. But when I talk to them, they're saying like, I bought it for the aerosol reduction, but I'm finding out that it has so many more benefits, whether it's productivity, safety, you name it. So it's worth trying.
Love that, Mike. And I have to thank you. So ABC, always be connecting. Mentioned this guy a couple times, maybe a few times. His name's Gary Vee. So he's one of my idols. And I was listening to his podcast, and Mike and Zyrus and the team were there. So he got me connected to be on Tea with Gary Vee. So since we're on live TV now, Mike, and like 1 million people are watching,
yeah,
take Gary Vee to be on this show. That's my next ask. So if you could just say, hey, team, Gary Vee, and maybe he wants to connect with a lot of dentists. So that's the next. That's my 2021 hurdle.
Hang on, I'll reach out to him right now.
Yeah. Text Gary Vee. Well, thanks, Mike. To reach out to Shine and learn about it, text Shine to 55444 to learn more. Really love talking to you. Really appreciate it.
Thanks, Paul.
Thanks so much.